Thanks everybody for coming. I think I need to mention that we're being recorded and also live streamed.
Oh, we're good to go. Greg had to get us started. He just gave the thumbs up, so we're good.
Okay, good. All right. So we can start with approving the minutes from September. Can I have a motion to approve the minutes?
I move that we accept the minutes from our last meeting.
Okay,
I
and
will.
in a second,
Me.
Tom, thank
Yep.
you. Okay, any discussion about the minutes? Okay, all in favor?
Aye.
Okay. Okay, it looks unanimous. All right, thank you, everyone. Just a few comments. I think you all got an email from Karen about the sexual harassment prevention training that we're required to complete. I believe that's due at the end of November. So just a reminder that we need to be doing that annually. And also just a word of encouragement for all of us to think of any possible candidates for positions on the board or on subcommittees. The nominating committee would, gladly follow up with any names that you suggest. So just let us know about that. And you can contact Jan or Stu or myself about that. Okay, can we move on then to subcommittee updates? Tom, can you let us know if any updates from your subcommittee?
Well, the report is in here. I can just reread the report because nothing's changed. It's Minnie Thomas, Family Treatment Court Coordinator of the New York State Unified Court System, spoke on the supervised treatment court programs. Carmen Guidi, the founder of Second Wind Cottages, explained how the cottage program supports the homeless and recovery efforts. Mr. Guidi will soon open a home for women and children in downtown Dryden, the Main Street. In our next meeting, Robert Scott, the executive director of the Cornell Prison Education Program, will speak about the program they have for educating inmates at Auburn Prison. I think it's a pre-release education, but these people can get a degree from this and get out of prison in much better shape than they were when they went in. And our second speaker will be the woman from Coty in the operation that runs out of Cortland County. And their runs from Cortland to Herkimer, and which is I don't know how they do it, but I contacted her to talk to her in person just to see how the operation works. But in November, I've got a speaker from the head of probation in Tompkins County, Dan Cornell, and I'm looking to have the captain of the Tompkins County Jail speak too. So we're working on it. So that's it.
Okay, thank you. Any questions for Tom? Great. Elise, do you have an update?
Sure, just a really brief update. So we have pretty much settled into a standing agenda of getting updates from the agencies in light of the ongoing pandemic and service changes. And there wasn't really any earth-shattering news for many of the agencies at this point, except that it seems like a lot of services are able to begin to resume in one form or another. And, you know, the folks that are in community residences are again able to receive visitors, although the logistics of that is complex. So that was good news. What we are monitoring the implication of a couple of different types of funding cuts that are impacting the DD system potentially. So one is the 20% withhold that is across the board, I think, to Health and Human Services in the state. And the other is that there were some pre-COVID waiver cuts as well that agencies were weathering. I think that mostly impacted the residential agencies. And so we're keeping an eye on that as well and how that might impact services to residents in the county. We continue to try to expand the people, the group of people who attend the subcommittee meetings. So over the course of the past year, we've been able to get representatives from all of the CCOs to begin to attend the developmental disability subcommittees, and we realized that we are actually still missing one CCO. And Sheila, I can't find my note on that. I can't remember off the top of my head the name of the care coordination organization that we are still missing representation from, but somewhere I do have a note to myself to invite a representative from that person or from that agency. And that's pretty much it. There hasn't been a lot of big changes yet in the DD service system.
Okay. Thank you.
That we are aware of. I will say, because there's some question of, you know, and I'm not sure that this is the right forum to bring it up, but there are some questions of larger actions possibly taking place in the background that might need to come to the attention of this group at some point in the future.
Okay, so you'll keep us informed about that.
I'm sorry, Lisa, I don't recall the agency either. Again, it's in my notes and I don't have them. So we'll try to remember and share that with the group next time.
Yeah, for next time. Thank you. Yeah, Mary, I will let you know at this point, you know, there's some rumors related to possible merger of agencies, but they're just rumors. And so, you know, we should wait and see if there's any actual movement in that direction. But then at a certain point, I would think that we would want to have some type of information about that possibility.
Okay. Great, thank you. Larry, do you have an update?
Yes. So the subcommittee met and had a very productive discussion about peer services in Tompkins County and learned a little bit more about how things are at the Jenkins Center. And also I let the subcommittee know about the decision to give up the contract for the care coordination program. And nobody had any questions or comments or concerns about that. I mean, they were concerned, but nobody said, hey, we shouldn't do this. Or people are concerned about how we're going to keep our finger in as the transition happens and people are transitioning from one provider to another. So that's feedback I want to give to Frank, which is we're going to have to have some sense of how the transition is going, both for the subcommittee and for the larger board. Unlike my fellow chairs, I don't have an announcement about who will be coming to the subcommittee or what we'll be doing in October, but it's only October 5th, so I have some time.
Okay. Paula?
I don't know if you know about this, Larry, but I read on the listserv that Unity House was advertising for a peer specialist. I don't know whether this is an additional position or they're replacing somebody.
Yeah, I didn't see it, but I don't know either. The other thing I would say that just came to mind is I sent a thank you to Josephine, and she emailed back to say that she and Tom, is that his name, the peer from Unity House, are meeting to talk about how to develop supports for peer specialists and other peer staff around the county. So that's happening. And I'm sort of defining, at least in my mind, I define the concept of peer pretty broadly so that it doesn't necessarily just apply to people who have peer specialist certification from the various agencies, but all the other people in town who are doing any kind of peer support. I mean, I
Larry?
realize that, yes, Jan.
Oh, I was just going to say that I think that posting might be a replacement, because didn't one of the peer specialists say
Yes.
he'd gotten another position in Albany or something?
Yeah, the gentleman Matthew who raised his concerns about peer work in Tompkins County has been appointed to some kind of peer-based certification or peer-based training. So he's moved to Albany. Hopefully he'll stay involved here locally a little bit, because I think he has lots of good energy. And so I felt like it was a really productive meeting. And we did, I don't think we took another vote, but we did reaffirm that we're really interested as the budget and the finance crisis go forward, that we really want to make sure we have a robust, or at least a functioning set of peers doing work in the community. Because we're going to have a lot of hard decisions to make, or recommendations to make to Frank and to the legislature as we go forward. And I think the mental health subcommittee is really wanting to make sure that the peer services are, a priority in our thinking about what we want the system to look like. I had a question based on Tom's report, and it's not, or that got sparked by Tom's report, which is, I believe several months ago, Frank was going to invite the new executive director of CARS to come and chat with us.
You're right. And I haven't done that yet.
Well, it's not like you haven't had anything better to do. So I'm just reminding you, it'd be nice to meet her.
Yeah, definitely. We'll have her come to our next meeting.
Cool. Oh, can I also say that for those of you who, this is outside my role as chair of the subcommittee, but the Human Rights Commission, the Health Department, and a couple of other entities within the county put together a really nice panel on the disparities that different groups of people are experiencing in the COVID pandemic. And Frank did a really excellent job sort of outlining his thinking and also outlining the work that's happening in the county. So I was very pleased to see that. It's available right on the county's website. So if you want to see Frank in action some more in a public setting, it would be good to look at. Plus, I thought the speakers were really excellent.
Oh, thanks, Larry.
Yep.
All right. Frank, can you give us your update?
I can, and thanks for that, Larry. Yeah, it was a really good opportunity I learned a lot from the folks that participated on the panel, so it was a really good opportunity. There will be a series of those. The health department, mental health departments, and human rights are partnering on these to kind of continue to try to move the conversation forward a bit. There'll be different speakers each time talking about kind of different impacts that we want to be focused on. So keep your eyes out for those. So a few updates, health homes, that transition continues. I did meet with the Honey folks last week to kind of talk through the process. We had to give them formal notification of our intent to not renew the contract. There are timing requirements in that needed to be done by the end of September, and it was. We have met with them to talk about kind of the transition process. They've assured us that they've done this in a much shorter time frame with much larger organizations. So they're confident that we'll be able to kind of navigate this successfully given the time frame that we have. The staff have begun reviewing all of the cases that we have currently, and we have stopped taking new intakes. So that was kind of the first step. They are reviewing the caseload to see what individuals are ready for discharge, as they normally would each month, but they're looking to go through that list now. Then the next phase will be to work with Honey to begin to identify the transition locations for some of the cases. You'll probably recall that the majority of our clients are Health Home Plus. And so we have to get some more agencies approved to do Health Homes Plus work in Tompkins County. I've talked directly with at least 3 of them that are interested, and we are in the process of writing letters of support for that so that process can move forward. So there shouldn't be a shortage of providers available for service provision in our absence. We just have to get through that process. So in the meantime, we will be looking at the cases and identifying who makes the most sense to transition first. We'll also be looking at staffing because, as you know, the county has committed to providing positions for all of our impacted staff somewhere else in the county. And some of those other positions are vacant and waiting for them to be filled. So we are working with the other department, which is DSS, to build a transition plan so they get their support as soon as possible, but that we do it in a manner that makes sure that our clients are taken care of and transition smoothly. So all of that is underway. Obviously we'll keep you guys updated as we progress through that. And once I know for certain about the other agencies and their interest level, I'll let you know. I think it'd be a bit premature to announce them just yet, but I wanted you to be aware that there are several that have interest in expanding. Oh, I gotta let Travis in, sorry. Staying on budget issues, the state is beginning to talk like the 20% reductions are going to be more long-term. We don't expect we're going to know anything for certain until the governor puts out next year's budget, which he normally does the end of January. We're not expecting him to make dramatic changes over the next 3 months, but we are expecting that we know they've already told us that the 20% withhold, as they're calling it, will continue through the 4th quarter of this year. Again, I don't think the governor is going to make any decisions on anything until he puts out his budget, but based on the way things are going, it doesn't seem likely that those cuts are not going to become long-term. So Jeremy and I worked on a survey that we sent out to all of our contractees to get some basic information on their thoughts about what they might do related to these cuts. And we will be having conversations with them over the next few weeks to kind of talk through their responses to that so we can get a better feel for what we think the overall impact might be. the county budget process continues. They have this week, I think, are the last of the county department presentations. And then next week they will begin their voting meetings. And those voting meetings are when the legislators can make changes to the county administrator's proposed budget. I don't know how any of that is going to go. It's a really weird year, and I think the legislators are just starting to get kind of the full picture of what the reductions are going to look like for the county, and so then they're going to have to make some hard decisions about whether they're going to look to fund things that were cut and or make other adjustments in the budget. But those meetings will be coming up next week, and then there is also the normal public hearing prior to any vote on the budget that is an opportunity for the public to be heard. Deputy commissioner recruitment, we did get some applicants in this last advertising period. So this week I will be sending those applications out to the hiring committee for review to see if we have folks in there that we'd like to bring in for interviews. So hopefully we'll have some candidates in there that we can talk to and potentially get that position filled. Strategic planning continues. The staff group has now met and provided some really good feedback to the consultants and Sam and I. So that process is continuing. They will be meeting at least once or twice more before the the advisory group meets again. But that process is still underway. One of the things that's been an interesting kind of dynamic is the county has released some county values. That's work that started back pre-COVID and has kind of continued. And a few weeks ago, they launched those values out to the department. So we're going to be incorporating that into our work. We're not likely to just adopt those as our values. They obviously will be our values as part of the county. But I think we are also going to have some supplemental private values that we want to that we as a joint department are going to want to exemplify as well. So it's interesting. It's interesting to see the crossover. It's interesting to see the different perspective from a countywide view to a department view. But that's all good stuff that's been underway. So we'll continue to update you guys as that progresses as well. I think you got a notice that Karen sent out about the state is going to be having listening sessions about the potential for bringing OMH and OASIS together. It's kind of been the worst kept secret for a few years now that there's been talk about this, but I think they're now moving to kind of a more formal process on whether they're going to make that move moving forward. I will tell you from the department perspective, we are supportive. It is very challenging to have those two different agencies that sometimes are not aligned and quite frankly, sometimes have very different approaches to how we should be taking care of folks, particularly with co-occurring disorders. And it would be good to have that kind of all together under one vision for how we're going to care for our residents with substance use disorders and mental health issues. So if you're interested in being heard, there's an opportunity for you there. And I think that is the list that I had for today. I'm happy to take any questions.
Larry?
So you talked about the transition process for the people in the health homes. To what extent will individual clients be consulted about their desires and what they think would be useful to them? I mean, I know they can say, but I want to stay here. I mean, so, but to what extent are people going to be asked about what a couple of different things, including what kind of services they need, but also what kind of services are available while they're transitioning?
Yeah, that is one of the benefits of having multiple agencies that are interested in providing the service here. It will provide choice. And the client will be involved in that. So there will be a review of their case with them about where they are, what their needs still are. There will be a presentation of the different opportunities that that exist for them, and then ultimately they do get to make the decision on which organization they might transition to. So we're trying to move as quickly as possible to get as many of them approved, so that way we can begin having those conversations with the clients so they can make those choices.
Any other questions?
Frank, I don't know if this is on the agenda because I don't have it up on my computer, but were you going to talk about a little bit about the case management, the Tammy Baker position, and that not being in the county budget?
We do have county budget issues on the agenda as an agenda item.
Okay, sorry about that.
That's right.
Frank, is there any update on COVID that you'd want to share, or where we're at?
How could I not say something about COVID? Yeah, it's been interesting times. Things are really good with higher ed. Cornell has got, things have gone really, really well there. Ithaca City School District is back in person today, so that's a victory. A lot of folks are excited. I think there's some in this call that are benefiting from that. So that was good to see. They did do some testing this last week that was available for students, and then later in the week they did open it up a bit for staff. About 650 people got tested between Wednesday and Saturday, and there was, I think, 1 or 2 positives that were identified out of that. So the prevalence in that population matches the prevalence in the rest of the community, which was good to see. So we're in a fairly good spot. That can't be said for most of the people around us. Broome County is blowing up. They had a 100-case day over the weekend. Chemung County is dealing with outbreaks at, I believe, at a nursing home and at Elmira College. Tioga has seen a spike. Cortland is dealing with SUNY Cortland students. So our region is struggling right now from a numbers perspective. The governor has turned his attention to specific zip codes that he's calling hotspots. Most of them are down by New York City and in the metropolitan area, but Broome County has a couple of them, and I think Onondaga perhaps as well. So there are places where the positivity rate's about 5.5% in the top 20 hotspot zip codes in the state. That kind of matches some of the states that have things statewide that aren't going so well. Thankfully for us, it's in a confined area right now, and our statewide positivity is still like 1.2%, which is still really good, but it doesn't take long for it to get out of control. And so those areas are putting a lot of effort into trying to get a control of the hotspots. There will be some information going out probably tomorrow or the next day from us, kind of reminding our community that yes, things are going well, but you don't have to look far to see that there's still problems, and it's really important that we remain vigilant with our mask wearing, social distancing, and such. So we're going to be pushing some of that messaging out in the next day or two. And then probably the most important thing, Halloween. We did push out some guidance about trick-or-treating for folks that started today. The guidance went out. There's a sign for people to put up on their house that are participating, and kind of some ground rules on how to try to do it safely. So lots of work going on around COVID. K through 12 has been keeping us busy. The guidance from the state has been challenging, and we're still working through some of that, but so far so good. We gotta hope that the things around us stay where they are and they can get those under control, so we can continue to see low numbers here.
Elise?
Yeah, along those lines, I'm just wondering, I imagine you're in communication with all the public health directors in the Southern Tier. I was on a call this morning with a bunch of special ed folks who work in Broome County and Chemung County. And they were talking about the fact that schools that have opened are starting to close again. Businesses are starting to close again. One of the people who I was on the phone with, they were pretty certain that their daughter had COVID and they were just waiting to find out because she worked in a nursing home. So it seems like it's getting very bad there. And it seems that we are in a bit of a bubble right now, but I'm a little bit worried about us sinking with the rest of the Southern Tier. What do you think the chances are of that we will end up having to roll back some of the gains that we've made here because of what's going on in those other counties?
Yeah, I don't think, particularly hearing the governor today, I don't think he's really interested in kind of regional rollbacks yet. He's focusing his attention on those hotspot zip codes. So, I'm hopeful that they'll be able to get those under control. The one thing that we're still not sure about either, that I don't think they ever imagined when they set up this regional approach, is Cornell's testing levels. We're doing 10 times more testing in this county than the next county in our region, and that's Broome, and they have twice our population, right? So Cornell is doing huge. We crossed the 200,000 mark a couple of days ago. So they're doing huge amounts of testing, which means your positivity rate is going to be low, right? Probably lower than it would be if you took us out of those numbers. So I don't know how long that's going to continue, but I don't think right now the governor is not talking about regional rollbacks. He's very focused on the hotspots. So, we're hopeful that they can get the resources they need to get those hotspots under control, and that ultimately it wouldn't negatively impact us if we continue down the same path with our prevalence.
Larry?
What about, we have a pretty significant amount of in-commuting from other counties for work and for other things.
Yeah.
Are there discussions with employers and with, for instance, tourism attractions that bring people into Tompkins County from surrounding counties?
Yeah, we haven't done so much with the tourism. Most of it's been with our larger industries. Obviously, Cornell is the biggest, and they are testing. If you come to campus, there is a testing protocol for staff and faculty as well. Some of the bigger businesses have contracted with CMC to do regular testing for their folks as well. So I think some of that is occurring. You're right, though. I think the planning department said something like we have 30,000 in-workers that travel in each day, and that's a huge number. And they're coming from counties that right now have much higher prevalence rates than we do. So it's really about redoubling our efforts. I think the good news here is when you look around, people are complying, right? They're wearing masks, they're distancing, they're taking those steps. And everyone that I talk to that works for the county, that doesn't live in the county, they're talking about doing their grocery shopping here before they go home, right? Just because of the different experiences between here and there. So hopefully, as folks are coming into the community, they're seeing that and they're becoming a part of how we're handling things here. Obviously, there's no guarantees on any of this. We just don't know. But we feel like we've taken every step that we can to try to limit the spread, and now it's really just a matter of maintaining that and hoping that the virus cooperates.
Paula, did you have a question?
I was just going to say that when I listened to our governor, and it sounded like even though he's focusing on those zip codes, but he's really focusing on our incidents and super spreading incidents, because he said things like, a zip code could divide. One side of the street is not in that zip code, but if that side of the street is a problem because it's got a religious institution where they're not practicing social distancing, or it's got a bar where they're not, that it would be dealt with, that's really what they're trying to control.
Yep.
And of course, that brings up a lot of legal issues. I know there've been a lot of lawsuits from religious institutions, saying that they're being discriminated against. He seemed to be pretty confident that legally he could close these places down.
Yeah, zip codes are an imperfect science, particularly when you get into New York City, where, a zip code is a handful of blocks. A zip code here is a big swath of land, generally. So it is it's a little bit different in that approach. And he did acknowledge that it's imprecise and that they are going to look at what is causing it. And they talked about schools, and they talked about religious institutions and gatherings being something they're going to be prioritizing. So we'll just have to kind of wait and see how that goes. Where the lawsuits have generally come from is if you're treating one group differently than another. The Jacobson the precedent from the Supreme Court way back in the day pretty much establishes that the government can take steps to protect the public's health. Where you run into trouble is if it appears you're doing disproportionate treatment to one group over another. So he's got to manage that and figure it out. And it's pretty obvious from some of the pictures that they were showing and the reports that we've been hearing that there are some groups that are just not complying, and they're turning into super spreading events that are creating some of the problems.
And my other question, Frank, and I don't know if you know this, is having students back making any dent in sort of sales tax increasing?
Yeah, it's starting to help. Obviously, we're never going to get back those 3 or 4 months when everything was completely shut down. So that's the challenging part. Jason and the finance folks, their predictions have been pretty spot on. And they're projecting an improvement next year, not all the way back, but it won't be like it was this year because we had the solid shutdown, unless of course, we get back to that point. But I think at this point, Cornell has demonstrated that they can do this safely. So barring something really significant happening, our hope is that there will be in-person classes for the foreseeable future.
Okay.
And I should mention probably the thing most pertinent to you all is the mental health department. We've begun expanding some of our in-person services. Pros, probably a couple of months ago now, started doing 1 class a day, then they expanded to 2. And so they're gradually expanding what they're able to do for in-person services using the pyramid room and some of the other spaces on the first floor. We are beginning to do the things where you get all the wires hooked up to you and you tell the truth. What am I talking about? The lie detector test. There we go. Sorry. For the folks with sexual abuse in our sexual abuse program. So that's an important piece of that programming. And we hadn't been able to do it for a while, but we're beginning to do that as well. And so as a clinic, we're starting to look at how can we strategically use mainly the first floor right now to begin to do a bit more in-person services wherever we can. So the staff has been working diligently to try to make that a reality. So that's good news.
Great. Thanks, Frank. Okay, moving on in our agenda, I had invited Janet Thibodeau to come back to talk to us further. Last month, she presented a very thorough PowerPoint that had been forwarded to you all. And I think our agenda kind of shortchanged her a little as far as discussion or questions that you all may have had. So she's here today. And I just wanted to open it up if any questions came from your closer look at that document. Well, I could start with one. I was gonna just ask Jana, what areas do you think we've made the most progress in as far as incident management?
I think when I pulled together that PowerPoint presentation, I was actually really surprised about all of the milestones that we have achieved and how we have responded. I think specifically because of corrective actions, but also just because I think that there's a general recognition of an area of improvement. And then we've worked to do that even during COVID. So I think that the substance use, that the number of overdoses and the number of clients dealing with substance use and our efforts to provide integrative care are both one of our greatest achievements and then also one of the areas that we still have a lot of work to go, because it is an epidemic in our country and in our county, and it's an ongoing issue. So I think there's no easy answer, and but I think there's also a lot of motivation and a lot of passion to address that within our clinic.
Okay. So in addition to that, are there areas you think we should be focusing on more?
I think that the substance use one is obviously, it's a dire need. And I think that especially during COVID, that I think Frank has mentioned that in our county, we are an anomaly, that areas around us, that there have been more overdoses. But I think that during quarantine and during this pandemic that overdoses have become more prevalent in general. And we won't probably be exempt from that forever. So I think that that's an area for us to continue to focus on. I also think this is more of an internal structure question for the Incident Review Committee, but I think bringing some of those milestones back to the committee to discuss there and talking about what the response to the corrective action has been and closing that loop and getting feedback from the committee about their insights about how that has, been effective and where we can sort of refine our improvement efforts and address things even better, I think would be a place that we could continue to work on.
Yeah, and I would just add that the co-occurring with mental health and substance use disorders, I mean, it's been a challenge for a very long time, but the staff they've done a lot of work to kind of move towards treating the whole person, right, in those situations. And that's no easy task for social workers that aren't substance use professionals, right? And trying to educate themselves, do the trainings and things to become more comfortable and talking about those issues. And then, in strengthening our partnerships with CARS and the Drug Council and now REACH as a licensed program. So, there's been a lot of effort and energy. We're not anywhere close to where we need to be. And quite frankly, I think it's going to take the social work development programs, the educationals, the master programs to begin to integrate that into their training. So that way, when they're coming to us for their internships, they already have some understanding about how to integrate those things. So it is a kind of a system-wide change that needs to occur. But I think staff has taken to it. I would say 5 years ago when I started, it was clear we were not substance use providers or substance use disorder providers. We were mental health providers, and that's what we were there to do. And I don't think that's really our approach anymore. I think if you talk to the clinicians, there is an understanding how the two things kind of intermingle. So that's the first step. Now we have to help them build the skills and comfort level to kind of address those comorbidities together, as they're seeing their clients. So it's there's a lot of work to be done, but I definitely want to give credit to the staff for their willingness to embrace this kind of new philosophy and how we provide service.
This past Friday, we presented to the staff some of the progress of the opioid initiative from Psyches. And also asked for some feedback to work on our substance use assessment. And part of the progress that we've made is to become an OOPP. And so that allows us to have Narcan kits. And the staff were really invested in the question of how do you get a Narcan kit to somebody if you're doing telemental health. So I think that people are really invested in finding solutions, even in such a dynamic environment right now.
Larry?
So one of the big things that we were hit with during the troubling audit was the extent to which clients had safety plans and I know that's a QA thing. That leads to my question about, you talked about some kind of, and I can't remember, but I wanted safety list, people who were on a list because they presented some safety issues. I wonder if you could talk about more how that process works, how somebody comes onto a list, how they get off. Are they people who are in the clinic? Are they people who are in other programs at the department? How does that work? Just so I know when we're talking about these issues, I understand what that is.
Absolutely. So we have a high risk list, and we revamped our policy and procedure this year so that we have a rubric of different criteria. So that would qualify somebody to be at risk, so that everybody's sort of working with the same definition. And
Yeah,
then
so
corresponding, yeah,
what's the technical name for it? What is the technical name of the list when you get on that list?
a high risk list.
Okay, cool. Thanks.
Yeah. And so there's two different categories. There's monitoring, and then there's high risk. And then there's a treatment team / high risk meeting every Monday morning, which has a psychiatrist, the clinic director, and staff and quality assurance. And we review the people on the high risk list and what their most urgent needs are, and how the psychiatrist and the clinician can collaborate to support that person. And also they look at the Rio data to see if they've been hospitalized over the weekend, or if they've had any health concerns or have gone to the doctor for that. And then they are generally seen more frequently. So they will be seen sometimes weekly or biweekly.
And how many people are on that list at any given time? Is there an average?
So there's about 80 people on it, on the clinic one. And then the pros has a high risk list too, but it's a much smaller program. So there's fewer people on that list. That's dynamic because you asked how people get on it and get off of it. And so
Yeah.
the clinician submits a form documenting what the reason is to add the person to high risk list. And then they route it within our electronic health records to the quality assurance department, and we add them to the list. And then removing people from the list is the same process. So generally it's discussed in the treatment team meeting, and then they route the form directly to us, and then we remove the person from the list. So there's documentation of when they were added and when they were taken off, and we can look at the average length of time that someone's been in a high risk status. And then we also send out a reminder email every Thursday to staff, and we say, of the people on your caseload that are on the high risk list, this person doesn't have a next appointment, or doesn't have a safety plan, or doesn't have a substance use assessment, or they've been on the high risk list for more than 60 days. So just sort of review that and add to your documentation the reason for them still being on the list.
So those folks get extra attention and review. Good.
Yeah.
Are they the kind of people who might end up also being, for instance, people who are connected to the outreach program at Family and Children's or any other community-based programs outside the department?
They often have a care manager from Health Homes. I don't believe someone can participate in Family and Children's Services and our services, because I think that is double dipping for insurance billing.
Okay. Not even for the Tammy Baker program? For the outreach program?
No, that's separate. That's not a billable service. So we would hope that these folks they might get onto the high risk list because of some interaction with Tammy. And then we would be able to, provide additional supports to get them off of the high risk list and not have them necessarily need to interact with Tammy. That's kind of the hope of how that works. But yeah, these are the folks most in need. And so generally they're going to be interacting with other support agencies in the community.
So what kind of connections do the clinicians have to all the different programs the so-called high-risk person might use? How good are the social workers at helping people to connect?
I think they do their best. I think that that's a constraint because their schedules are pretty busy. And it's probably an area where we've identified that we can have memorandums of understanding, for example, with REACH and with CARS,
Yeah.
and see to formalize those communications. That we have, I think, pretty good relationships with the court system, especially the Ithaca Wellness and Recovery Court. So I think that that's the way that we collaborate through the court system with other providers in our community.
And really what you're describing there, Larry, is more the role of the care managers in health homes, right?
Yeah.
So the partnership is important.
But at the same time, the people who do clinical therapy, most of them are at heart social workers. So
That they are.
right. So
Something that we've also worked on is having more collateral information in the client's record. So even if the psychiatrist doesn't have time to connect on the phone with another provider, that they can read the discharge summary from the hospital, for example, or potentially a treatment plan from an OASIS provider.
thank you.
Okay, well, thank you, Jana, for giving us more information, and that's really helpful.
Yeah, absolutely.
All right. Frank, have we covered the strategic planning update?
Yeah, sorry, I got a little ahead of the agenda, Mary.
That's fine. Okay, so we should move on. Our final item is the county budget discussion. I know that some of us have heard different items that are not being included at this point in the budget. So we wanted to have a conversation about making sure that we're all aware of these things. I think we need to make a decision about, do we want to send a letter to the legislature, pointing out some of the things that we think are important for them to take a good look at. Would it be helpful, Frank, if you could maybe summarize the things that you think are going to be impacted?
Yeah, I don't know how much I can add. I was hoping Shauna was going to be here, but she had a family situation she had to deal with. I haven't been to all of the department presentations, and quite frankly, the challenges on mental health and public health were enough to try to navigate. And I guess the one word of caution, I don't know if that's the way to describe it, but this was a very difficult budget season. And I know there are, some things out there that we hear about not getting funded, and we're like, oh my God, that absolutely has to get funded. We cut 14.5 positions between the two departments that I'm responsible for. And there's, I think, 36 others throughout the county, that positions that are being eliminated. So this is a very significant cut for the county. And while I know some of these projects that we want to see funded might be small dollar amounts, when you start plugging all of those in, they start to add up. And then you have to decide, well, are those small projects a priority over potentially restoring a position that we might be losing in another place. So sometimes we can kind of lose the bigger picture of how significant this is when we see the small cuts in programs that are very particular to us. So I don't have a lot to offer. I know the outreach worker position, as I understand it, was left out of the county administrator's budget because he wanted to see if the other funders were going to include it in their budgets. I believe at least two of them have, the DIA and the city. I'm not sure if the mayor has even presented his budget yet. I haven't been able to keep track of that, but so I don't know where that's going to end up in the conversations, but I can tell you the day that I did my presentation to the legislature, they grouped us together by committee that we report to. So all of the HHS departments reported in that one meeting. So if you really wanted to get a picture of what's happening, at least in the human services departments, you could just watch that one expanded budget committee instead of having to, look through 8 or 10 of them and find the pieces you want. DSS reported, Office for Aging, Youth, Human Rights, the Health Department, the Mental Health Department. We were all on the same night, and so it might give you some insight into what's happening in the human services programs. But what I can tell you is that at the budget process, they're finishing up expanded budget committee meetings this week. And then I believe next week they start their voting meetings. I think I actually said this earlier. My apologies for repeating, but that's when they will get into the decision making that the legislature is going to have. So if there is something that you're concerned about, it is, we're coming up on the time where you want to have your voice heard. I would tell you that I am quite frankly more concerned about the 20% cuts from the state and what that's going to mean to our service providers. It's certainly going to impact the department, but the bigger impact is going to be on all of our service providers that we contract with through the state as they try to navigate that. So we got to get through the county budget, and then we're just going to get hit again when we get to the state budget next year, and trying to figure out where we're going to find those reductions as well. So I can try to answer questions if there's anything in particular that you guys are interested in. I apologize. I just haven't been able to follow all the departments as closely as I might have in previous years.
Sure. Yes, and I had just some brief contact with Shauna, and she was still kind of sorting through exactly what the impact was going to be. But the one item that seemed clear was this outreach worker that has become a pretty important role in our community.
Yeah, and I think that's going to come up, and I think there's interest from the legislature, and I think coupled with the other agencies that are funding, if they do come through with their portion of the funding, I'd imagine there will be some funding from the county. I'm certainly not promising that, but if I'm reading tea leaves, that's kind of what I've been hearing. If I could offer an example from public health that might shed some light on how complicated this is. We've made position cuts at public health. We've eliminated positions, we've reduced hours, and then we've had some small contracts with outside providers that we've eliminated too. And so using environmental health as an example, it's something we're working through the legislature now. There's a small grant for about $28,000 to a local laboratory to run stream and creek samples that our volunteers collect to get a picture of what the water quality is. And it's been going on for years and years, and it was just something we couldn't cover in our budget. And so there's been interest from the community in getting that put back in. When I look at my budget, for that amount of money, I have 4 senior level sanitarians in my department that I'm losing 2.5 to 5 hours a week from because I had to make reductions of almost the exact same amount. And so if you're asking me, I would prioritize those hours over the sampling contract, and the department and the division would agree with that. And then you get to the point, well, maybe we could do both. Well, if you put 2 pools of $28,000 together, now I have enough money where I could reinstate an eliminated public health technician position, which would be our first priority if we had that much money available to do. So when you're looking at a budget that has these levels of cuts, every little bit of money that you put back into the pot almost reshuffles the whole deck on what we would prioritize if it's available. And I think that's the thing that the legislature is going to have to work through over the next few weeks is, $28,000 doesn't seem like a lot of money for a stream water sampling, but when you start adding 28,000 here, there, and in other places, it starts to become restoring positions that we're losing. And we don't want to do all the little things and not really think about whether we would prioritize a bigger thing if we had that pool of money, if that makes sense. So that's just an example of the complexity that goes on in a situation like this, and that's going to be the challenge for the legislature to navigate.
Yeah, I think that's an important thing for us to keep in mind, is just what a difficult position this year is, and the decisions they have to make are very, very difficult.
Yeah, I mean, it's a crappy situation, it just, nobody wants to be here. Nobody wants to be making these decisions. Like I said, there's 14 and a half positions going away from these two departments that we've had to navigate through, and that's not fun. Some of them had people in them, namely the health homes folks, and those are conversations we don't want to have. Those are people we know and care about. Thankfully, we're able to get them work somewhere else with the county, but it's still not their first choice, right? And so everyone's under a lot of pressure in trying to figure all this out. And I would absolutely agree. You should advocate for the things that are important to you. That's how the legislature knows what's important, but also, recognize and understand that everyone is trying to do their best with what they have. And if something wasn't funded, it really isn't a statement that that's not valuable at all. It's just when you're prioritizing a bunch of bad decisions that you have to make, ultimately somewhere the line has to be drawn.
Larry?
So, how much money is in the current budget to help fund the outreach program at Family and Children?
I don't know the answer to that question, other than I think it's zero. Because I believe the county administrator in his budget did not fund the program.
No, I mean the budget now.
Oh,
To the program now.
Larry, I unfortunately, I don't know that number. I can get it for you. It's not in either of the budgets that I operate, so I don't know what the total value of it is.
I think we need to know what if you could find that by then, I think it would be good to know how much are we talking about? Just so we're actually talking in real terms. Philosophically, I just want to remind people that the health homes, the clients of the health homes will be transitioned to another program and will somehow get their needs met. Some of them will, of course, not be happy with any of the choices and maybe choose not to participate.
I'm trying to track that number down right now. I don't know if I'll get it before we're done, but on the health homes piece, I would agree. And Janet was, I'm sorry.
Just let me finish. But this is the second time that the board has sort of been confronted with dealing with a program or thinking about a program that is supposed to reach some of the most vulnerable people in our community. And I'll say what I said during the discussion about the health homes. This is why the mental health department exists, to provide support to the people in the community who need it in order to avoid higher levels of care and in order to avoid interaction with the mental health, with the justice system, and to keep their connections with the mental health system and other support systems going. And as far as I know, unless people have been disingenuous about the results of the outreach program at Family and Children's, those kinds of goals are being met. And I don't see any reason, especially in an economic crisis, why one would reduce services to the most vulnerable people who are going to end up going to more expensive services. And it's so frustrating to me that at least in the budgets that I'm aware of, we've been asked to to approve of, or at least allow services for the most vulnerable people change dramatically. So I really just think, and I'm very aware of what Frank is saying. So I know nobody's making this decision because, oh, you know, we don't need this service. But I really think that as advocates for people who are mentally ill or having problems with substance use or having trouble with homelessness, that we should be supporting those services. And also, I don't know how many of you are aware of the tensions that are happening at the Ithaca Police Department, but recently a deputy chief released a letter on Facebook, and among other things, he said that the Ithaca Police Department is still having to do a lot of things that it shouldn't have to do. One of the reasons why the outreach program got support from the county, the city, and the IDA was to try to help buffer between police officers and people who are in crisis. So I don't see any reason why we would eliminate a program that's doing that. And as far as I know, is doing that successfully. I mean, it's not a huge program, so it's not like we have 15 people out on the street doing this. We have 2, plus other people, but we have 2 people whose job it is to do this work. And so I don't see why we want to eliminate this particular program.
So the dollar value for the county is $60,000.
Okay.
Do others have comments about this?
There's 2 people in the position, right? Two staff.
People,
Another position got added, I think, in the 2020 budget.
yes.
Mm. And the second position was just added like a year ago or something, wasn't it?
Yes.
Last year.
Yeah, so I don't know. And I know it's very complex looking at a huge budget that also has a million other pieces that have to fit in. But one thing to think about might be whether just keeping one person doing that work. I know preferably, you know, if you look at it in one way, it would be keeping it going with both, but
It does seem like the county is likely, the legislature is likely to put that funding back. Again, I'm not promising anything, but based off of what I'm hearing, I think there's an appetite for putting that funding into the budget.
So,
I think
Frank, do you think it would be useful just to express our opinion that any kind of funding would be appreciated just because of the work that we need to have done in the community? I mean, not to say restore this funding, blah, 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 but say, look, we really think it's important just to add our voice to that. And Mary can, put it however she wants. I mean, we can go on about, and not in a crass way. We can make it clear that we understand that it's a difficult budget year and all of those things, because it is.
what would you all think about sending a letter like that Larry's describing.
I think that I'm concerned as well, but I also feel like I'm not well informed enough about, the total picture and all the pieces
Mhm.
to feel like maybe there's even another program or another position that if we heard about it, we would be concerned about it. But because we don't have a total picture, at least I don't, I'm not saying it's secretive. I'm just saying, it's not obvious. So it's
Mhm.
hard to tell.
Yeah. Sheila?
Yeah, I feel the same way. I'm certainly, I think, I would love to have Shauna come. I know she was supposed to be here, but I would like to get a bigger picture, and certainly Shauna can share, what we're thinking as a board. But I don't know all the pieces yet. And as supportive of, I'm supportive of a letter, certainly, but I don't know what that means in the overall budget. So it is a tough budget year. There's going to be very tough decisions. And I just think I personally need more information before I could say, yes, let's support this, this letter.
Okay. Paula?
Yeah, I wasn't clear about Larry's position. He started by talking about family and children service and then shifted to funding for the two social workers. So I'm not sure if he suggested maybe shifting funding from family and children to the two social workers. If he could clarify that.
No, I was talking about the program at Family and Children's.
Yeah, what about them, Larry?
What?
What
Well,
about family and children?
Yeah. No, I was talking about continuing the funding, or at least assuring that some funding go to Family and Children's to run this program that's been successful.
All
Dr.
right,
Duplan,
okay.
the outreach workers are employees of Family and Children's. So the contract for that program is with Family and Children's.
Okay. No, I understand. Sorry.
Okay.
Paula?
So I agree that I'd like to hear more about this, and it would be good to have Shauna, when she's available, talk about it. The only thing I would say is that if the legislature is already considering putting this back in, then it's something that's maybe easier for us to support, and whatever is going to push them over the edge in terms of keeping things, we might have more impact. We want to make sure our impact isn't going to end up taking away something else.
Mhm.
So that's why I'd want to hear from Shauna about what they're thinking.
Okay.
Frank, is there some place that we can get a bigger picture of what the different budgets are to just be better informed about this?
Yeah, probably the best place, and it's probably a couple hours of your life if you want to watch it, is the budget, the budget presentation for the HHS departments. I'm trying to get a link for you right now. The good news is this year they did lump us all together onto the same day, so it's a little bit easier. I ended up in the wrong place. So it is
It's on the county website.
Yeah, I went to the wrong department. Yeah, if you go to the county administrator's county administration webpage, there is then a budget. You'd think it would be easier to find. Oh, here it is. County budget and financial information, the 21 expanded budget. There's the highlights. Budget prior to 2018. Oh, you know what? Actually, it might be on the legislature's, because it was a public meeting that was recorded. Sorry. clicking on the internet under pressure is not one of my strong suits.
Well, you don't have to do it right this minute. Maybe if
Right.
whatever you find, you could send it to all of us, after the meeting.
Yep, yeah, the recordings are here. So I will figure out which one it was, and I will have Karen send out a link to it for you guys.
Thank you.
Okay, so then we can get more information about the bigger picture. Okay, I'm also happy to contact Shauna and see if she can put something in an email to us and answer some questions so that we get more information too. So I can do that. Larry, did you have your hand up?
Well, that's what I was gonna ask about. How can we get Shauna's input?
Okay.
I mean, maybe for those of us who wanted to, she might be willing to do a Zoom meeting. I mean, I don't want to pile things on her plate, but if she were able and willing to, but an email would also be fine. I just want to agree with Paula that once we have a better sense of
Thanks, Martha.
Yeah,
what's
I know. Well, thank you, Jason.
happening
Oh,
with other departments, then we can pretty quickly put together a nice request. I mean, I don't feel like we have to go to battle about this. I just want to feel like we're not sort of sending off a letter in the dark. I do tend to think that in terms of I shouldn't say that. So, but it would be nice to have a better sense. Because for instance, it could be that they're cutting something at the Human Service Department and we go, can't live without that. And I mean, I asked about homelessness cutting cuts to homeless programs. I think that's particularly an important place where we should look.
Okay. So we have the link there, Frank put in the chat, and Karen will send it to.
Yeah, we'll send an email too with the link to that and the county's budget page, which has the budget document. If you want to look at it, it's if you don't know what you're looking for, it's a lot of numbers in a 400-page document. So if you want to hear directly from the department heads, that video would be the best way to hear, and you'll hear what I said as well.
Okay, so and then I'll email Shauna and see if she can answer some of the questions that we have. And it sounds like we need to be doing something between meetings. So I'll check in with you all and see what other questions you have, what your thoughts are about us communicating anything to the legislature.
Yeah, and I would just share that when they do their voting meetings, that's when you get a feel for where the legislature's at, right? Because they always have the opportunity to levy more taxes, right? If they want to find money for things, and so I'm not advocating for raising taxes any more than they already are, but it is an option that is there for them. And when you hear them in those voting meetings, you can start to get a feel for where their head's at about whether they're looking to do with what they have, or maybe raise more revenue, or move some things around. You get a real good feel for where they are, and then there's a public hearing that occurs after those voting meetings are done and before any action is taken on the full budget. So there are opportunities in there to kind of learn where they land at. Like, for example, you'll know by the end of the voting meetings whether they put the outreach worker funding back in. And if for some reason it doesn't get in, you still have the public hearing as an opportunity to have your voice heard about your feelings on that.
Mm-hmm. Right. And Frank, thanks for putting it in the context of, all the painful cuts that are happening and those difficult decisions. Thank you.
Yeah, it's been a difficult year. Staff are, they're hurting too, right? Because they're the ones feeling this. And I guess the last thing I would offer on this is just as you're communicating about this, just be mindful that there are people whose positions are being eliminated. And when you advocate strongly for one thing, the first thought is, well, why aren't they advocating that strongly for me? right? So there's that morale and kind of, human component to all of this as well. So again, that doesn't mean not to advocate. It's just to keep that in the back of your mind when you're choosing words.
Okay, thank you. So, is there anything else we need to cover tonight?
Can I just ask, Jan put in the chat box that Jessica came to a community services board meeting, and I thought I remembered that, but Larry had me questioning. Do you remember her coming to a community service board meeting? Jessica Jensen from CARS?
Yes, because at the end of the meeting, we were concerned that they were doing genetic testing, right?
Yes, yes.
So, and you got the answer to that they had checked that it wasn't being distributed widely or whatever, it was protected.
Correct.
So that's what I remember anyways. If I'm
Yeah.
wrong,
That was the full board, right?
I thought so.
You're not on the mental health subcommittee, right, Jan?
I
think it was a subcommittee meeting.
I am.
But I
I
also,
switched from
It would have been
DDCAT.
substance use subcommittee, right?
I'm not on that.
I think it was the substance. I think I attended that substance use subcommittee.
Okay,
Yeah.
so maybe it was a subcommittee. I haven't gotten her to the full board then.
yeah,
No, it was the full board.
Oh, what?
Yeah. Anybody else remember her coming to the full board? Just Elise and I. We're the only
I'll
ones that-
see if she can
Elise,
join the
Frank
next
and
one.
I.
Even just
swear.
For another
Look back in the
introduction,
minutes.
we'll have her, I'm sure she'd drop in for a minute just to introduce herself again and say hi.
that's,
So we can make that happen for you.
Okay, great. All right. Well, can I have a motion to adjourn?
oh, but this is so much fun.
In a second? Larry, okay. All right, all in favor. We are adjourned. Thank you.
All right.
Thanks,
Thanks.
everyone.
Good night.
Night.